Oh, recording in progress. I'm glad that you mentioned that you're learning, because that's kind of a big important part of this is, you know, I've worked with every kind of service provider you can imagine. Actually, the funny thing is, for more than 10 years, I was like the only Spanish interpreter for all of the early intervention providers in like a 5-county area. So every single OT and SLP that works with the birth to 3 crew, for Achieva and TICE and EIS and PTP and, you know, all of the county service providers. I've been with them for 20 plus years and we're all dear friends, and my company still provides all of the interpretation to all of them, and we have great relationships with all of them. So if any of you newly graduating SLPs and OTs are interested in working in early intervention, I would be happy to make introductions for you. And so feel free to reach out. But back to the slides at hand, you know, Michelle, when you said we're learning and we're trying, I think that's really key, because one of the things I've noticed with language access at hospitals and in schools is that people kind of can get paralyzed because they're worried they're not doing it right. Right, or they don't know how to use the resources that are available. And so they'll just kind of say like, oh, well, is there somebody here who can help you? Is there a family member who can interpret it for you? Or, you know, just, do you understand English? And somebody will kind of say yes, and they'll just sort of go with it, because it's hard and intimidating to change any kind of paradigm, right? And the paradigm right now is that in a place like Pittsburgh, there's just not a lot of infrastructure for language access, and most of us aren't used to using these tools. And so one of the ways I like to approach talking about this with people is not like you're doing it wrong because you haven't been providing language access, but more of a, this is new for a lot of us and we're all learning together kind of attitude, right? And I think that's really important, because it's really easy to kind of beat ourselves up, but we don't tend to praise ourselves when we're trying and learning new things. So with that being said, I'm going to go ahead and throw up my slide deck here, and we're going to talk about improving outcomes and enhancing relationships through language access, right? And a big part of that is defining what we mean when we say language access, right? And I think it's really important to understand what language access is, right? To understand the logistics of it, to understand especially the importance of it. Because I think that results are better for patients and for consumers, and people are more likely to provide language services when they understand what's at stake, right? What they understand really the depth of the problem. Also, another way to define language access is that truly it is the law. We haven't seen a whole ton of activity in terms of like legal action or complaints and things like that historically, but you're going to learn in a minute that the LEP, or limited English proficient population, is growing super duper quickly, and it's becoming more of a problem. And so lawsuits and complaints are cropping up all over the country, where governments are getting sued and healthcare systems are getting sued, school districts are getting sued for not providing interpretation. And so we'll talk a little bit about what the laws are. The 3 main laws that have a lot of precedent that really say that any federally funded operation, be it a nonprofit, a government, a school district, et cetera, a healthcare provider, that accepts any federal funding, and that could be a grant that's federally subsidized, it could be accepting Medicaid, it could be the normal kind of, you know, funding that drips down, you know, into an early intervention provider, for example, and the type of funding that we get from the county, from the federal government for those programs. But Title VI of the Civil Rights Act of 1964 is really the big one. This prohibits discrimination on the basis of race, color, and national origin. And language has been held up in court as a proxy for national origin over and over again. There's quite a bit of legal precedent, and there's a great website if somebody wants to put it in the chat, because even after, oh wait, I got it. I was gonna say, even after 2 years of using Zoom, I sometimes get weird about how to chat while I have slides up, but I figured it out. There's a lot of information about Title VI as it regards language access on lep.gov, which I just put in the chat there. There's also Executive Order 13166, which was basically a Clinton administration EO that strengthened and reinforced what the provisions of Title VI are that mandate language accessibility. And then there's Section 1557 of the Affordable Care Act. There are other laws. Section 2 of the Americans with Disabilities Act is kind of the intersection of disability with language access. There are lots of, state and local laws, but these ones are solid. And more governments are starting to have language access plans and starting to put language access policies in place. And we're going to learn in a minute that that's because even in Pennsylvania alone, we've got about 1.5 million people who speak a language other than English in the home. And of those, about a third or 500,000 people are considered what we call LEP or limited English proficients. There are 156 languages represented in Pennsylvania. And this is old data, right? We know that LEP populations are notoriously difficult to count. And so by all accounts, this is a very conservative estimate of how many people there are. The real number is probably much higher. This is also older data. This is from 2016. Migration Policy Institute, that keeps its eye on these sorts of trends, cited an 80% national increase in the number of LEP individuals in the United States between 1993 and 2013. And again, that's old data. This is assumed to be a faster growth rate now. And so wherever you're at in your career or the work that you do, maybe you've worked with a few families here and there who don't speak English or have trouble communicating, but more and more are going to start coming. And so the work of building resources, tools, the ability for your organization to have a plan and to be able to communicate with and provide services to these people is really important to develop now, right? And that's what language access really is. It's providing meaningful and equitable access to services for people, right? Because we know that compared to English proficient people, those with limited English proficiency tend to be less educated, more likely to live in poverty, and have poorer health and experiential outcomes overall. So let's look at some more sort of qualitative stuff, right? Can you guys, this is great that we have kind of the perfect size group for these activities that I'm going to do. Can you just kind of say out loud some of the things you think it might be necessary to use communication for? And this can be anything from riding a bus to opening a bank account to, enjoying a play to signing up for, electrical utilities, right? Just anything that comes in your mind, just type it in the chat or say it out loud.
I always think of healthcare, finances, financial challenges, whether it be like refinancing a home, disputing something on your credit card, anything financial, anything dealing with your children, such as, challenges at school.
Yeah.
I think of healthcare because I used to hear that a lot from friends that were international. They would only go to physicians that could speak their language.
And that begs the question, what happens if there is no physician that speaks your language, right? Which is the case for many of the languages.
Even here in Pittsburgh, I know that a lot of people that I know would travel to New York for physicians that could speak their language. And that was just bizarre to me. I mean, to me, I live in rural Pittsburgh and people travel into Pittsburgh, but to think of people traveling from Pittsburgh to New York to find physicians that speak their language is mind-boggling to me.
Yeah. Well, and what we'll see in a minute is what ends up happening is people just don't go to the doctor, right? And so we also see higher rates of preventable illness in LEP populations. Have you ever tried to schedule an appointment with, just your PCP through, AHN or UPMC, either one of them? You just can't do it if you don't speak English. There's no way. They have like a press 2 for Spanish option, maybe somebody will call you back if you press 2 and you speak Spanish. But what if you speak Urdu or, Kinyarwanda, right? And Nepali, and languages that are heavily represented in Pittsburgh, right? And so asking for simple directions, ordering food, going to the grocery store, attending sporting events, concerts, these are also in the chat. Yeah, and I want you guys to be thinking, this is something that really affects every kind of aspect of a person's day, right? From the time they leave their house in the morning to the time they get home. And that's what I want you to be thinking about in terms of what is language access, right? The actual boring procedural definition of language access is what is achieved when individuals with limited English proficiency can communicate effectively with your program staff and participate in your programs and activities. And that's a pretty good definition. But while we're talking about definitions, I want to call attention to this term limited English proficiency quickly. Does anything jump out at you guys about the term limited English proficiency as a label for people? And it's okay if it doesn't. Well, the big thing is that it's a deficit-based label, right? Because right off the bat, it identifies people as being limited, right? And even well-meaning advocates and people who, mean well and want to help and are by all stretches, progressive and are trying to do the right thing, can form biases when they think of somebody as limited, because language is very powerful, right? And so calling somebody limited in their English proficiencies can have real consequences, not even, oh, somebody did put deficit focused in the chat. Thank you, Sophia. Yeah. Even those of us who are advocates and who are trying to help might, form biases where we start to think about people with limited English proficiency as sort of needing to be saved by us, right? But language access isn't about saving someone or coming to the rescue or being like a knight in shining armor and doing things for people, right? That's putting words into people's mouths. That's actually taking agency from people, right? Language access is not about speaking on behalf of people, right? It's about helping others use their voice. And when you use a deficit-based label like limited English proficient, the kind of go-to reaction for most good people who want to help is, oh, I need to help. I need to do this for them, right? But really, they need to be able to do things by themselves. These are capable human beings, right? They don't need us to speak on their behalf. They just need equitable access to services, right? And that is what language access is, right? So, again, defining language access in all of these ways is super important. In terms of the limited English proficiency debate, limited English proficiency, or LEP, is the legal procedural term. You'll see it on lep.gov. You'll see it in legal briefings. You'll see it everywhere. I use it in context when it is the appropriate procedural term, but you'll hear me a lot of the times just say simply a person who does not communicate in English, right? Because there are some other terms people have proposed, like English learner. In schools, they use English language learner. But those are problematic in other ways, right? They assume that somebody has the ability to learn English, which is kind of ableist. Not everybody does have that ability, right? And none of these terms are intentionally ableist or, deficit-based. They just are what they are. And I think being aware of that and being mindful of the language we use to talk about people is something that's really important. So I just wanted to point that out as kind of an important thing in the discussion about language access. But we talked a little bit about all of these different things that require communication, right? Medical appointments. And it's not just, going to the PCP, it's scheduling the appointment. It's understanding text reminders. It's understanding, questionnaires and, release forms and waivers and informed consents and being able to communicate with the doctor, right? And understand a diagnosis and to get meaningful, equitable access to healthcare, right? Not just good enough access to healthcare. And this is everything from mental health care to prenatal health care. We see a lot of LEP individuals who come in, 36 weeks pregnant, and that's their first time they've been seen during a pregnancy, right? Food, right? This is applying for SNAP benefits, knowing where food banks are, knowing how to take advantage of any kind of food assistance program, reading health labels, right? To avoid peanut allergies, like knowing how to go to the grocery store, right? There's so much more under each of these categories. And I've written just some of them down on this slide here. Just to really reinforce that point that this is something that affects every single thing a person tries to do, right? We use language for everything. And when you can't use language, for anything, especially in a place that doesn't have language support and infrastructure like Pittsburgh, or where very few service providers have language support like Pittsburgh, what ends up happening is that people withdraw, right? They don't attempt to use these services anymore. And that's bad for the community at large. That's bad for individual families. It also deepens the divide between immigrant and refugee populations and the rest of us. It prevents people from integrating and thriving, right? And so most people don't realize how diverse Pittsburgh is. It's a very diverse city, but people are hidden. And people stay in their neighborhoods and they stay in their lanes and they're not integrating, and you don't see them because it's just too hard, because there's no language support. As part of the All for All Coalition, and I'm also on the Allegheny County Department of Human Services Immigrants and Internationals Advisory Council, there was a 2-year learning process called the Community Blueprint, where we went in and we interviewed and spoke to hundreds of immigrant and refugee families about, the quality of life in Pittsburgh for them. And the number one strategic priority identified across the board for all of them was language access. And it continues to be that, right? And so another thing I'd like to really hammer home in these presentations is how important it is to people, right? And how much of an afterthought it is if you've never had to think about it, right? And again, I go back to what I said at the beginning of the presentation. That doesn't make you a bad person. It just means you've not had to think about it, right? And so now we are thinking about it, and that's awesome. We know that there are really serious effects on economic, social, and health outcomes. LEP individuals are less likely to report assault and unsafe conditions, right? And this makes communities less safe. Errors caused by poor language support cause financial losses, unnecessary calls, for police or for public servants, and inefficiencies across the board. On the flip side of that, they also cause catastrophic problems for the individuals who don't communicate in English. An example I always cite is when I was working in early intervention as the interpreter, a lot of our families, our mamas were pregnant, and I would always tell them, don't sign anything until I get there when you're in the hospital. And then I would go to the hospital, because after they give birth, the nice social work ladies go around and collect demographic information. And they use that demographic information to produce birth certificates, right? And so they'll come into the room after somebody's given birth and they're exhausted. I've done this twice. It's not fun. I could barely speak English after both times. And they'll say, do you speak English? And the family will say, yes. And so they'll ask all the questions and collect all the demographic information. And then, 4 weeks later, the families will get an incorrect birth certificate in the mail, right? I saw one where the father's first name was Roberto, and the birth certificate said Rob as the first name and Erto as the last name for the father's name, right? And it's terrible, but, for somebody like me, if it happened, I could call and sit on the phone for hours and go downtown and get a certified copy of my birth certificate and correct the birth certificate. If you don't speak the language, it's next to impossible. And if you're not, if your legal status is, out of status, or if you aren't, here legally or whatever, then you now have no legal proof that your children belong to you. And that's really terrifying, right? And that's just one potential outcome that we don't even have to think about, but that happens all the time. I mean, this happens all the time in all of our hospitals in Pittsburgh. And that's one small example of the kinds of losses and inefficiencies and problems that happen because of language access. And then loss of public trust and negative impact on reputation for police, firemen, healthcare providers, really anyone. I mean, we saw a lot of mistrust of information from the CDC and from the government with regard to COVID. And a lot of that is rooted in language, right? And language accessibility and the kind of isolation that it causes. So I want to do a really quick kind of activity. And I want you to really think about a time in your life when you did not feel like you had a voice or that you could communicate. It could be a funny story or, something scary like getting lost in another country and not being able to read the bus schedule or the signs to find your way back. It could be something silly. I'm going to share one that's kind of silly. It could be anything really. It could even be like when I ask my kids to put their shoes on for like the 100th time, and it's like just not getting into them. It feels like I can't communicate, right? The point of the exercise is to share the story and then to dig deep and to think about how it made you feel, right? And so the example I always use is I lived in Mexico City for 3 years. And also in Costa Rica for 3 years. And so by the end of that, all my Spanish was great. At the beginning, my Spanish was not so great. And Mexico City is really big. There are close to 25 million people there, and everybody speaks super fast, like, Brooklyn slang, Spanish. And I was at a party and I just remember feeling really out of place and really awkward because my Spanish was not great. And even that alone made me feel like I didn't belong there, and it made me feel uncomfortable, right? But then I kept trying to tell people that I was embarrassed by my Spanish and using the word embarazada to say I'm embarrassed. And embarazada is what's called a false cognate. It's a word that you think means one thing, but does not. It does not mean embarrassed. It means pregnant. And so I was walking around this party, telling everybody, oh, I'm pregnant, I'm sorry, like drinking beer, hanging out. And people are like, okay, whatever, lady. Okay. And I just I didn't really know what was going on. And somebody finally nudged me and was like, hey, that word does not mean what I think you think it means, right? And we all had like a good laugh, and everybody kind of was just like, oh, joke's on you. And it was silly. And, then the party continued. But even though I was able to laugh at myself, I felt so embarrassed and I felt ashamed, right? And I felt stupid and I felt like I didn't belong. And I felt like I just wanted to run away and curl up in a ball, right? And I felt just kind of like disgusted with myself. And I felt like I was the idiot gringa that, was in Mexico and didn't speak the language, right? So I would love if you guys could also share some stories and then talk about how those stories made you feel. I'm going to stop the share just for a minute so that we can have this conversation and see each other's faces, because, understanding how language access really affects people, I think, is one of the most important points of the conversation and about learning about language access. So, Pam, I see your hand up.
I have a story. I frequently get my nails done. And, when I go to get my nails done, oftentimes they're all speaking the same language and I'm not. I don't know what they're saying. And sometimes it almost makes you paranoid. Like, are they talking about me? Are they, if they laugh, are they laughing at me? Did I do something wrong? Like it's an uncomfortable feeling because you can't participate and you can't even say, oh, they're just talking about the weather, or they're just talking about their kids, because you have no idea. And, I've been going to my same nail person for, 14 years, and I'm still uncomfortable. And I've known him for 14 years. And my kids go to school with his kids, and I'm like, talk to me, tell me, what do you like, and it's still uncomfortable 14 years later. And I consider him a very dear friend. And I know they're not talking about me or laughing about me, but it's what you feel. Your mind can't help but to wonder what they're talking about that you have no idea.
Yeah. Yeah. And it makes you feel kind of helpless, right? Because there's nothing you can do. You have no control. Like you can't just magically understand, right? So thank you for sharing. I think that's a perfect example. Are there any other feelings you can think of?
It makes me feel stupid. I feel that in America, we all learn primarily English. Okay, I could say I speak Spanish, but not fluently. I've been to Mexico and I can get by,
Mhm.
but many individuals where English is their second language, they've by far passed us in how much they've actually learned, how much they've actually overcome. English isn't an easy language. And oftentimes it makes me feel like we as Americans are so selfish, stupid, and just living in our own bubble. Like, well, we don't need to learn other languages. You know what I mean? I don't know. I can't explain it. I can't find the right words. I need that second cup of coffee. Sorry.
That's okay. Those were all great. And it's about being honest more than about sounding eloquent or being right, right? I mean, this really gets at where language and identity intersect and how language has the power to make us feel, right? Would anyone else like to share a story or an example? Yeah.
I have one similar to yours, Mary, but I had always wanted to go to France and to Paris. I always thought the language was so romantic, and I was learning it in college and high school. So I thought I knew something. But when I went there by myself and was like looking for directions and trying to use my French, the French R is really difficult to say for an American. We just don't have that sound in our language. So just trying to use it and then seeing their reactions just made me feel like I clearly just didn't get it, and they had a hard time understanding me. And it was just that wake up call of like feeling like I don't belong there, feeling incompetent. Just it wasn't a great feeling, but yeah, Parisians can be a little bit unforgiving, but they like that you try, but it just feeling like I clearly just wasn't American.
Yeah. Stigmatized, right?
Very stigmatized. Yeah.
Yeah. Thank you for sharing that. I'd love to get at least one more. Yeah. Oh, I thought I saw your hand up, Ashley.
Oh, I can though. I do have a thought.
Yeah.
It's actually, I find it really devastating when I can't talk to like my dogs back home. Like there's no way when I'm like leaving and I can't tell them why and like explain why. That's really frustrating that I can't explain myself.
Yeah.
And they just think that I'm just like leaving them or like leaving them at the vet like forever.
Yeah. And you're like, no.
I know, yeah.
But
Come back, I promise.
Yeah.
But, or like I'm doing something to help you, like.
Yeah. Yeah.
But
that's a great example, right? So these are all examples of having communication kind of taken away. The ability to communicate is something we really, I think, take for granted, right? Because most of us have never truly had to deal with it in the way that a person who doesn't communicate in English, has to deal with it here in the United States on a daily basis. And so just in that short exercise, I wrote down some of the feelings that you guys said and the ones that I said. And just in those couple of minutes, we had stupid, embarrassed, ashamed, wanted to run away, out of place, stigmatized, devastating, frustrated, misunderstood, sad, paranoid, uncomfortable, can't participate, no idea, helpless, stupid came up again, selfish, in a bubble, difficult, don't get it, don't belong, incompetent. And these are just a few of the really complex feelings that people report having when they're not able to communicate, right? And I'm going to share the screen again I have some more of them on the next slide. Oh, just kidding. Nope, that was a different presentation. But, you know, people say depressed, people say, you know, angry. People say all kinds of sad and emotional words to describe how they're feeling when they can't communicate. And so if you think back to that list we sort of made of all of the different things you need to be able to communicate in order to access, excuse me, any kind of preventative health care, food services, right? Education, talking to your, you know, kids, teachers, scheduling appointments, signing up for benefits, food, you know, whatever. Every single one of those things is dependent on communication. And when people cannot communicate, all of these feelings we just described, depressed, you know, stupid, embarrassed, ashamed, out of place, paranoid, like I don't belong, can't participate, no idea, helpless, in a bubble, difficult. Those are how people feel every single time they try to access any one of those services, right? And that's devastating, right? That's what language access means, right? By the time they even get to you, they're exhausted, right? There's no way for them to meaningfully or equitably access any of the services that we all need to survive and thrive without feeling all of these feelings, right? That's huge, right? When we think about the social determinants of health and well-being, right? The level of depression in LEP communities is through the roof. We know that they're not getting healthcare. We know that they're not showing up for services, right? This is why. And that's why language access is so important, right? So I think kind of once you've understood why language access is so important, it's also really important to understand, you know, how to recognize when you need language access resources and then what those resources are, right? Like what's available to you. How can you change this paradigm? A big one is remembering that just because a person says they understand what you're saying, that doesn't always mean it's the case. A good example is the birth certificate story that I gave earlier. A lot of the times people think they will understand, right? This happened to me once when I thought I was like a hot shot and my Spanish was great. I was taking like a airport shuttle in Costa Rica that a friend of mine, he was like the driver, and he let me hop on for free so I could get a ride. And he made the announcement that they were going to stop at a rest area and take a break. And there was some, you know, come back within a certain amount of time rules. And he said it, he asked if anybody needed it to be said in English. And I was like, no, I got this, you know, I understand Spanish. I totally didn't understand like, you know, 80% of it. And I faked it. And then he had to come find me because I was like going to miss the bus. And he was really mad at me. And he's like, why didn't you just tell me to say it in English, you know? A lot of the times people don't really have an understanding of this dynamic, right? They might not know that they feel isolated and alienated because of the language, right? They might not know that their level of English is not sufficient to talk about a medical diagnosis, right? They might not know that more supports are needed themselves, right? Or they might say, you know, I simply don't want an interpreter. I want to learn better English, or, you know, I have my daughter here, she can interpret for me, right? And so it's our job as service providers to know when to use an interpreter. Sometimes it's easy because people will just say, hey, I don't speak English, I need an interpreter, right? But you can also kind of tell if somebody doesn't seem to be like grasping the information or responding appropriately to your questions. That's usually kind of a red flag that some language support might be needed. If a person is nodding and answering yes to all of your questions, or their answers are limited or don't quite match up with the questions, right? That's another kind of signal that an interpreter should be present. If you know, a patient or a consumer is difficult to understand for you, then you also should get an interpreter for yourself, right? Or if somebody asks a family member to interpret or tries to use an app, right? These are all red flags. You should always get an interpreter because remember, there is a legal basis for this, right? It's not just, I mean, I wish that feel good was enough, but it's not always enough. Pam just put in the chat, a medical diagnosis can be hard enough to understand in one's primary language, let alone a language that is not your primary language. That's very wise. And it's also a really good point to bring up before I introduce the idea of why it's not a good idea to use family members or untrained bilingual staff, untrained bilingual nurses as interpreters, because they may not understand the terminology either as they're interpreting it to people, right? We'll get into that in a minute, but you know, I think it's also important to remember that even if somebody does have a high level of English in times of stress, illness, with aging, a person's proficiency in their second language is likely to decrease and an interpreter might be required. We have an SLP in training in the group, I remember, is it Julianne? Probably understands the concept of expressive and receptive language. The ability to understand is different from the ability to speak or produce language. And they both take up like a huge amount of cognitive bandwidth, right? You've just given birth, that's in the toilet, right? Like you're not, I wasn't even speaking English clearly after, you know, having babies. So, or, you know, if a loved one is sick and you're emotional, you know, your language proficiency is going to decrease, right? So the go-to and the safest thing to do, especially if you're federally funded and you're working with people where vital information is being exchanged of any kind, is to just have an interpreter, right? And even if people tell you they don't want an interpreter, you can say, I'm sorry, I have to have an interpreter. Julianne wrote here, just because a person says they understand what you are saying, that may not be the case. This makes me think about policemen reading Miranda rights and how literacy contributes to communication as well. Absolutely. A lot of the times people will rely on Google Translate for things, to show people things. Not everybody has literacy in their home language, especially in Pittsburgh. If you actually look at the linguistic communities that we have here, a lot of them come to Pittsburgh via refugee camps where they have not had formal education. And many of the elders do not have literacy in their first language or in English. And indeed, some of the languages aren't even written languages, right? My language spoken by a lot of our Somali Bantu refugees is not a written language, for example. Simplified language, we'll talk a little bit later about slowing down and, you know, using simplified language when you're talking to people through an interpreter. The types of language access resources that are most available to you, once you've kind of decided, okay, I need an interpreter, I need some support here. There are many, these are just a few. The big ones are written translation, oral interpretation, right? Interpretation and translation, a lot of the times people will conflate the two, but they're very different. They're actually totally different practices and disciplines and have totally different skill sets. Somebody who is a good translator is not necessarily a good interpreter, and vice versa. There's over the phone interpretation. There's video, this should say remote. I don't know why it says relay on the slide, I'm sorry. Video remote interpretation, which would be when you have an interpreter over Zoom or some other platform. And then what's called sight interpretation. And sight interpretation or sight translation, both terms are common, is when you look at a document in a source language, such as English, and then orally render it into a non-English target language. So a waiver or a consent form or something like that. When it comes to interpreters as resources, this slide was produced by the Joint Commission, which is the major certifying body in medicine. You know, other patients in a hospital, other people in, you know, a room, bilingual helpers, as I like to call them, volunteers, children under 18 years old, especially not, family members, especially not, untrained staff, even if they're very competent and really want to help, they're not interpreters. And so they don't understand how to do it in a way that is effective. And so again, then you're not meeting that legal standard of equitable and meaningful access. Also, think of a scenario in which what often happens is if you're using an untrained interpreter, they'll talk, like if we use the example of a doctor's office, they'll talk to the doctor about the patient rather than having the doctor speak to the patient and look directly at the patient and make eye contact with the patient, right? And if you're, a Swahili speaking mom who's come in to talk about family planning when it's, a taboo thing and something you're already uncomfortable with, and it's been really hard for you to even make the appointment or get there, and here you have some bilingual helper just answering questions on your behalf instead of interpreting the questions to you, and then just talking to the doctor or the medical provider about you rather than to you, that's actually going to be even more alienating than no help at all, right? And we see this happen over and over and over again. Another big problem is they don't have the actual skills, right? Interpretation is an actual profession. I mean, we have to balance body positioning, eye contact, managing the session, making sure we're meeting all of the ethical standards, making sure we're clarifying, making sure we know when to interrupt so that we don't leave anything out. There's a ton of training and time and work that goes into it. Most interpreters have terminal degrees and do 7+ years of training. Translation, again, I teach applied translation at Carnegie Mellon University to master's students. And by the time they finish a master's program at CMU, they're barely competent to translate, right? So being bilingual is not the same thing as being an interpreter or a translator. And that's a really important thing.
Hi.
Oh, sorry. And so we're going to watch this silly video here to really drive that point home. And the reason being that the use of non-professional interpreters is very widespread, and it's really important to understand why it's bad news. Why it's bad news bears. So we're going to watch this silly video. This was produced actually by the NHS in the UK, the National Health Service, and they have a wonderful language access program. So they have a lot of great resources as well.
Bryony, I'm the health visitor. I'm here to see Natasha.
I'm Alexei. There was some problem with the interpreter.
Yes, the dates got mixed up at the interpreting agency because an appointment was moved. Thanks for doing this at short notice.
That's okay. I have a business in the city. I can afford to close it for an hour. Well, come in. I will take your coat.
How are Mum and the baby?
Yeah, they're good. Baby's sleeping now. He snores like his father.
Your brother?
My brother, Victor.
And Mum?
She never leaves the house. Natasha?
Здравствуйте.
Hello.
Nice to see you again.
Она рада тебя видеть вновь.
How are you?
Как поживаешь?
Хорошо, спасибо.
Good, thank you.
And how is your baby?
Как ребенок?
С ним все хорошо, но он очень плохо спит.
He is well, but he doesn't sleep a lot.
Shall we sit down?
Ты предложила присесть?
Да, конечно, простите, пожалуйста.
Yeah, of course. I'm sorry.
So are you making sure you get enough time to rest?
Спрашивает, есть ли у тебя время, чтобы отдохнуть?
Я пытаюсь, но с ребенком так много работы. Так устала, что ничего не хочу делать.
Well, she tried, but there's so much work with the baby, and she tired and don't feel like doing it.
Если бы я была с мамой и сестрами, они бы мне помогали. А тут я совсем одна.
If she will be at home with mother and sisters, they help her with the baby, but here's just herself, and it's hard for her.
Are you worrying about things a lot?
Не слишком ли много ты вещей на себя берешь? Не нервничаешь ли?
Я чувствую себя сильно одинокой, ведь я все делаю сама.
Well, sometimes she feels alone, and that she's doing all these things by
Ну
herself.
ладно, не говори, прости.
Yeah, she shouldn't say that. Что ты такое говоришь? Я специально с работы ушел, чтобы тебе здесь помочь. У тебя Виктор есть, всегда можешь к нему обратиться. I'm just telling her that she has Victor and I'm here, and she needs to ask if she wants more help.
Does Victor help out with the baby?
Oh, he's very good. He's a good father. When he gets back from work until he goes to bed, he's always taking care of baby. He's a wonderful, wonderful father.
That's good. Can you ask Natasha?
Тебе Виктор помогает?
Да, он очень хорошо ладит с ребенком.
Oh yes, he is a very good father.
Просто он всегда занят на работе. Я никогда не могу ничего у него попросить. Я очень одинока.
But sometimes he is very busy at work and she don't feel she can ask much of him. Что ты хочешь еще от Виктора? Он постоянно работает, чтобы вас тут прокормить. Неблагодарная. I was telling her that my brother, he works day and night to feed them. She's ungrateful.
Right, okay. Look, I came to weigh the baby and he's sleeping. There's some leaflets I want to bring. Can you tell Natasha this, please? There's some leaflets I want to bring you.
Она здесь брошюрки принесла.
So I'm going to come back tomorrow. Are you free tomorrow at 2?
Здесь она брошюрки принесла. В общем, завтра собирается в 2 часа вернуться. Здесь будешь? I'm working tomorrow afternoon. I cannot come.
That's okay. I'm going to book an interpreter.
Она собирается переводчика привезти. Why? I can do it. She's my family.
No, I prefer to have an interpreter here. It's better for me. Okay, now I've got to get to another appointment, but I'll be back tomorrow at 2.
Завтра в 2 часа вернется.
Спасибо.
Thank you.
So have any of you all who have done direct service had that happen? Or anything like that happen, or seen anything like that happen? When I do big trainings with lots of service providers, most people will be like, oh yeah, that's what happens every single time. Because you know, when family members interpret, they have biases and they're not trained, they don't know how to do it correctly. So what are some of the things you guys noticed that were kind of like wrong about what this guy did or how this guy interpreted? Yeah, Michelle.
It's interesting because I immediately picked up on the bias. Well, it was my assumption based on the body language before knowing that was her brother-in-law. And it just made me think, like, something you said before you went to play that video is just like there's differences in being bilingual and providing like an actual translation service or interpretation service, and then to have him just like his body language, I was like, why the bias? It made me think like, okay, he's providing this interpretation, but there was obviously a bias based on I didn't know, and then it made, you know, it clicked that he was the brother-in-law, and then it started to go back and forth. But it made me think like how many folks, even not relatives, have a bias that may be in that work that could be doing a family a disservice.
Absolutely. And, you know, power dynamics exist within families, you know, and especially around control and healthcare and women's health. You know, we see a lot of spouses interpreting, and that is very problematic for that reason too. Yeah. So body language, bias is clear immediately. What else did you guys notice?
He talked directly to her when he wasn't, like, there was a point where he wasn't translating and he turned to her and like corrected her and stuff. There was conversation going on the side.
Exactly. Yeah. Rather than interpreting to the subject, he kind of answered on behalf of the subject, or, you know, didn't answer the question, or maybe didn't interpret everything that was said. Right. And that's a real problem and something that happens all the time. Yeah. Anything else? The only thing I would add is that she seemed, you know, a little bit scared. Like there was obviously a power dynamic there, right? And a lot of that stuff is missed if you're not using interpreters, right? So thanks for watching. Like I said, it's a silly little video, but it really does present a lot of the issues with using family members or any untrained people as interpreters, right? There are many, many more examples of why that's bad that I can share. But for now, I'm just gonna hop back in. And move on to the next slide. So you guys know now what language access means. You know why it's so important. You know some tips for kind of spotting when you need to use language access resources. You know that the most common language access resources are telephonic interpretation, video interpretation, in-person interpretation, written translation, and that site translation thing that I mentioned. But what do you do if a patient is insistent on using a family member as an interpreter? Or I say patient because I think I originally wrote this slide for a medical provider, but if a subject or if you're an OT provider, what if a parent of the child you're working with or the subject that you're interviewing just is adamant that they don't want an interpreter, says they don't want an interpreter? One of the biggest things you can do is have waivers specific to language access pre-translated into like the top 5 languages that your agency or organization comes into contact with, right? So most of our clients have these in their top 10 languages, and they're all the same languages around Pittsburgh, namely Spanish, Nepali, Arabic, Russian, Chinese, Swahili, I'm forgetting some, Vietnamese, French, and we're about to have a whole bunch of Pashto requests because of all the Afghan families coming here, right? And so most organizations have waivers and certain vital paperwork already translated into those 10 languages. That way, when somebody's in and they say, I don't need an interpreter, they have them sign the waiver. And the waiver is a formality that lets them know that they're signing away a legal right that they have, right? Also explaining to people that they will not be penalized or charged or billed for an interpreter is really important. Sometimes people decline interpreters because they think there's a cost associated with it, or they think that, you're going to think they can't speak English and treat them poorly as a result of that, right? Because a lot of them have had run-ins with people who are, like, oh, well, this is America, you should speak English, right? And unfortunately, that's kind of jaded them, right? Explaining the pitfalls of relying on family members is okay to do, right? You're allowed to, be in charge. You're allowed to say, hey, family members don't usually have professional interpretation skills. And I know that you've worked with your family member in the past, but they're not qualified and I could get in trouble, right? You can say, my boss requires me to have, a formal interpreter. But if they really just don't want an interpreter and they've signed that waiver, then the best you can do is just proceed with caution, simplify your language, and be very vigilant for miscommunication, right? And when I say simplify your language, ask one question at a time. Be very clear. Speaking more loudly does not help, but slowing down does help. Pausing in between sentences to give people time to process that receptive language. Those are all things you can do to help ensure that the communication runs more smoothly. Understanding how to integrate language access into your programming is kind of the next step of having, individual staff members who know how to work with an interpreter and who understand language access is one thing, but integrating those services into your organizations is another thing altogether. And it's really important that everybody at an organization understand the types of language access resources that are available to them, right? If you have a language access vendor for translations, make sure you have a vendor list that has a phone number on it, right? This is our translation vendor. These are the people you should call to get something translated, right? If you need an interpreter, dial this number, right? And then each person at the organization should also be trained for how to use these resources, right? Sometimes with telephonic interpretation, there's a little bit of a learning curve because it's a little awkward because there's a lag on the phone and then you have to pause and wait for the interpreter to interpret, and it can get a little awkward. So giving people the opportunity to practice, right, and things like that. Getting it right in terms of teaching any kind of clinical or public facing staff that you have, about accountability and about how important it is, about what your policies are. Having a policy for language access is also a really important sort of institutional fluency part of the equation. Having some kind of quality control for written translation and oral interpretation, especially if you're using Google Translate and things like that. As somebody who teaches translation technology, I can tell you that machine translation can actually be really effective. It's a great tool for basic communication, for reminding people about appointments, for asking simple questions. It's not a good tool for relaying any kind of vital information. Vital information being like, information about health and diagnoses and, court dates, medication instructions, right? Things like that that are really, really important. But, for even somewhat complex communication, like maybe a letter home to students about Wacky Wednesday, where your kids get to wear, socks on their heads for school that day, right? That stuff is actually kind of okay to go through machine translation in some cases. What people don't realize is that the quality of machine translation is highly dependent on the language pairs, right? So the way these systems work is basically the more data they have to learn from, right? Because a lot of it is adaptive AI or artificial intelligence and what we call neural machine learning. And so machines are quote unquote learning from existing information, right? And so when you have a lot of information and a lot of good information, the result is going to be that the machines learn in a very good way, right? And they reproduce good results. If you don't have a lot of information or the information you have is bad, then the machines are learning from bad and insufficient information. We have a ton of information between Spanish and English and Mandarin Chinese and English and, French and English. We do not have a lot of quality information between Vietnamese and Kinyarwanda, or, even between Haitian Creole and English, or between Spanish and Arabic, for example, right? And so the output really depends on the language pair. And I would really say that English to Spanish, Chinese, French, and a few other languages are really the only ones you'd want to depend on. But for those languages, absolutely, the kind of non-vital communication I was talking about is totally fine. And it's okay to tell people within your organization that, right? There's also sort of, from an institutional fluency perspective, a difference between comprehensive service and what we call ad hoc service. If you are doing kind of ad hoc service where you're just, scrambling to put together language access resources, or you're using, bilingual staff who haven't been trained, and there's no real program or policy around language access, it can serve to further disconnect, patients or clients from their care. In a healthcare setting, it discourages people from returning, also in any kind of, I think, service sector related place. It leads to miscommunication and poor outcomes. It can create those inefficiencies and extra expenses we talked about earlier. Whereas if you have a comprehensive service plan, or even a basic, plan for how you're going to handle language access, people can speak for themselves. They will take an active role in their own care, in their own service, and it minimizes preventable illnesses and increases patient return rate. Right, so this was also from a medical training that I did, but it increases the likelihood that people are going to enroll in services, whether they're medical or public safety or public utilities or any of the things we mentioned, right? And so increasing wellness and community safety and those social determinants of health and well-being is really important, right? And so when more organizations are planning for this and start implementing this, slowly our region becomes more accessible, right? And that's kind of the work that my company does, the work that my organization does, the social impact stuff, is we stand up on a soapbox and we tell people about language access, and then we teach people how to do it. So hopefully this is helpful. And I have just a few more little bits of information for you, and then we'll do about 10 minutes for a Q&A. Machine translation, I talked a little bit about how the quality varies by language pair, right? But pitfalls of machine translation in general are that a lot of the meaning can be lost because not even the best or most well-trained neural networks yet can replicate context, right? And context is so important for communication. Again, the quality of the translation is dependent on the language pair. There can be significant grammatical errors that can be really distracting from the meaning of the text. And the biggest thing is that there's no system whatsoever for error recognition or correction, right? So Google Translate is just performing one function. It is reaching out into the universe and kind of putting together the most likely match for your query. And that's it. And that most likely match is the translation. It is the result. And that involves no double checking or making sure the context is correct or making sure the right meaning of a word is used, right? And so you have to be really careful when you use it. And it just should never be used for those, like I said, vital communications, only for basic communication, appointment reminders, things like that. Over the phone interpretation is a really good stopgap. You can't always get an interpreter in person or on video right away. And sometimes people walk in and they need an interpreter right then and there, right? And so having a phone interpretation system is really helpful because, it's quick and it's convenient. You can call, enter a PIN, and be connected to an interpreter of maybe 150 or more languages within minutes. It's cheap for the most part. I mean, I think the bigger your organization, the cheaper it is. But it tends to come in at around $1 a minute, and then you can use it anywhere, right? From your cell phone. It's remotely accessible while you're in the field. So you don't have to go somewhere and meet an interpreter in person, right? You can kind of do it on the fly. But the cons are that quality control is a serious issue. A lot of telephonic interpretation companies kind of hire anybody who's bilingual and throw them in there to interpret with very little training. And there's a very high turnover rate because the pay is terrible. They're paying people pennies on the dollar. And so the interpreters are kind of just like bilingual people who are at the grocery store and have the app on their phone. And if they want to make, 80 cents, they'll answer the call and interpret. But a lot of them do a really bad job. Some of them are quite good, but not many of them. It's not appropriate for any kind of meaningful, lengthy, or specialized content at all, right? Any more vital communication, because nonverbal cues are lost and accuracy can be very poor. And again, you never really have a way of knowing if the interpretation is good when you're using a telephonic interpreter, unless it's a system that leverages your own linguists, and those are kind of few and far in between. So phone interpretation is great, but not always. Machine translation is great, but not always. I like to think of it all as this is a big toolbox and you have many tools, and learning how to use each tool appropriately is really important, right? Knowing when to use machine translation, when to use a phone interpreter, when to get a real interpreter, what to have pre-translated, right? Those are all things you can think about if you're creating a language access policy. And then, a way to just kind of tell yourself if it's going well. Does the family or client seem engaged, or do they seem disconnected, right? Are they, kind of glazed over and not really paying attention, or are they answering and engaged in the conversation, right? Is the interpreter observing best practices, right? So are they using first person speech? Are they interpreting everything you're saying? Are they doing the opposite of what that guy in the video did, right? Does it seem like the number of words they're saying kind of matches the number of words you've said, right? Like if you go on and say a whole, lengthy poem, and then the interpreter only interprets like 2 sentences, they might not be actually interpreting everything you're saying. And a big one is whether or not the interpreter is having what we call side conversations, right? Interpreters should not be having side conversations with you or with the subject, right? They should just be interpreting. They shouldn't be involved. They shouldn't give their opinion. They shouldn't be chit-chatting, right? They're just there to communicate. One final tool I'm going to share with you guys is something that is really great to put in your physical space. One of the big challenges is figuring out what language somebody speaks if they just kind of walk in off the street, right? This is especially true in medical offices. So the one on the left was created by the Allegheny County Department of Human Services Immigrants and Internationals initiative. And it says, hello, please point to your language. Interpretation is available to you free of charge in all of these bubbles. And so people who can read them can point to their language, right? And that'll tell you which language they speak and which language they need an interpreter for. And at the time this was created in 2016, these were the most common languages in Allegheny County. Sometimes literacy is an issue, however. Sometimes people will recognize their language enough to be able to point at it, even if they can't read it fluently. But if literacy is a challenge, you can show them this flag identification chart, and most people are able to point to their country. Country is not the same thing as language, and in most countries, many languages are spoken, but it'll be a starting point, right? So if somebody points at Kenya, you can assume a Swahili interpreter. And even if Swahili is not their first language, it's a safe bet that they'll know enough Swahili to be able to tell you, no, actually I speak Kinyarwanda, right? So thank you guys so much. Did I stop the share? Okay, good. I want to make sure that we leave some time for Q&A. And if you guys want to talk about challenges you've had around language access, I'm happy to help you troubleshoot them. If you want to share stories about any of this that you've encountered in your careers, really anything for the next 10 minutes. I'm all ears and I'm happy to help. And I think there's a lot of value in peer-to-peer support. I'm sure the mentoring partnership understands that as well, to be able to use each other's experiences to kind of realize that we're all in this kind of together, and a lot of us have the same challenges and it's not unique, can be very helpful. Yeah.
I have a funny story and something that I was thinking about that you were saying that's much more serious.
Okay.
The funny.
Which we want first, the good news or the bad news?
I think the funny's funnier.
Okay.
It's a translation for jerk chicken, and it says rude and unreasonable. And it's funny.
Unreasonable chicken.
It's the perfect example of why you can't just always trust translations. Do you know what I mean? Because jerk chicken is clearly not chicken that's rude and unreasonable. But that was my funny story.
That's great.
But when I was thinking about family members interpreting and things like that, I think of my own family and not interpreting, but just hearing what they want to hear and sharing what they want to hear when it comes to health. And I'm sorry, I'm using health as an example because I think that's probably something that's a little bit more scary to us than ordering rude and unreasonable chicken at a, you know what I mean? My family's very much in the health care world. I have a mother who's a nurse, a sister who's a pharmacist, a sister who's a physician assistant. So they all have their very, very, very strong beliefs in medical backgrounds and a history there. I will hear of a diagnosis from somebody and I really don't know whether or not this is earth-shattering and, the kiss of death for them, or if it's a minor inconvenience in their life.
Yeah.
Because that medical background. So when somebody, when I hear about a medical diagnosis, I'm like, I don't know if this is really on the bad scale. How bad is this?
Right.
And somebody with a medical background can also have two different views. I'm making this up. My mother may be like, oh, it's really no big deal. And meanwhile, my sister's like, are you kidding? This person's going to be lucky to see, you know what I mean? Like, and I'll use something like cystic fibrosis. I mean, cystic fibrosis is something very, very serious. Some live very long, fulfilling lives and others do not. And how your own bias can just influence that without the language barrier, let alone translating with the language. And I would think that's very, very difficult to be a translator in the medical field when you don't want to share your personal biases, you want to share the information. Yeah. But it would seem only natural for a family member to want to share their personal, like, this isn't that bad. You're going to be fine.
Exactly. Yeah,
maybe what they really need to hear is the truth,
Yeah.
even if it is not ideal news. They
So-
need to be able to deal.
Yeah, and an interesting thing is that sometimes family members, it's funny that you said they need to hear the truth. Sometimes family members will not just be, they'll not do it because they're just interjecting their own opinion, but they'll do it because they want to protect the people they love by not telling them horrible news, right? Or something like that, right? And that can do a huge disservice too. I didn't mean to cut you off there, but that's a really good point. Yeah. Yeah. Any other comments, questions?
One of the things that kept coming up for me as you were sharing was going back to like our work of the importance of relationships. It made me think of my time in higher ed when I was working with students who English wasn't their primary language, and just the and I'm not sure like what that looks like in building trust, but I imagine like how not having access to materials or information in your language, how isolating that would be, how that can impact mental health and well-being. Like there's such a fallout. I think if that was me, like I would not be willing to be so vulnerable to get the assistance. So I could see myself saying, sure, I understand, because I wouldn't trust the process, just knowing my personality. But in thinking back and working with students, I had two things that happened to me. And now listening to you, I just feel privileged that they even shared. One student, I worked with students who needed additional support prior to getting to college level courses. And a lot of students where English wasn't their primary language fell into that category because of the testing system, right? No other reason than the testing system. And one student said to me one time, asked a question about the score, and I mentioned, did you take the tests where for students where English wasn't your primary language? And she said, no, because I knew English. And I went to explain like how that would have been beneficial, etc. And she said, well, why didn't anybody tell me that? She's like, when we come to school, and she like said, we like those that aren't English speaking, she was like, we want, we're learning English. So when I come, I'm going to say yes, because I do, not realizing like the other test was set up to make you more successful than seen as a deficit. And her willing to share that with me was just like, well, why aren't other people explaining it that way? And I'm like, I don't know, like it makes sense to me to explain it, but they weren't. And then I had another student just in talking, sometimes I can talk fast. Like she did tell me like, you need to slow down because I'm translating in my head and I can't move that fast. But I go back to like, again, don't know what I did, but I'm gonna then ask a question like, if you have any tips for us, how to build that relationship so we can encourage people to take advantage of the rights that they have available to them for the interpretation, especially when we're confined by systems. Like sometimes the systems we operate in don't have services in place to support. So how do we individually advocate and try to help build that relationship to get folks the services they need? If that was like a big and loaded question, but if that makes sense.
No, it is big and it is loaded, but it's really important. And that is kind of like the $1 million question. On one hand, I believe the onus is always on us to just provide the services, right? On the other hand, people do need to understand that they have rights, right? And they, a good comparison, if you look at the Americans with Disabilities Act, obviously I don't want to conflate disability with language proficiency, right? They're not the same thing, but from an accessibility standpoint, procedurally and in a programmatic way, the problems and the set of problems are very, similar. 30 years ago, we were having these same conversations about, why do we need wheelchair ramps, right? Why do we need screen readers? Why do we need accessibility measures, right? And members of the deaf community were really left behind, and we're using family members as interpreters. And now 30 years later, we've built this infrastructure, right? And one of the big pieces of it that's been so great is that the deaf community understands their rights, and any hospital nurse or physician will tell you that most members of the deaf community will demand an interpreter. and they will wait there until you get them one. And many of them will refuse the video ones because they're not as effective and they understand the rights that they have, right? It took a long time to get here with that. And we're just kind of at the beginning of this journey with language access for foreign languages. And another problem is that culturally, sometimes people don't want to make waves, or they might be undocumented and they might be afraid that if they assert themselves, you know, they're going to get deported. And that's a very real fear. Or they might, you know, be met with, you know, a really negative response if they do assert their rights and then never do it again, right? And so it's really complex and, like you said, Michelle, loaded, but also really crucial. And I believe personally the first step is for service providers to start posting notices, you know, doing social media engagement in language, you know, doing know your rights campaigns, working with grassroots organizations. We do a lot of work with Casa San Jose to teach people what their rights are. And these would be Spanish speakers and speakers of indigenous languages from, you know, southern Mexico, Guatemala, El Salvador, and Honduras. And that's all great work. And, you know, unfortunately, even though it is the law, not everybody is in compliance. And so the norm, I'll see you, Pam. Thanks for all your feedback. The norm is that these services don't exist. And so I think we have to kind of change the paradigm first to give people the space to assert their rights, right? That's just me, but that's a great question. And I want to be mindful of your time too. It's 11 o'clock. And so thank you all so much. Michelle, did you have any last questions or comments or closing remarks?
No, just I want to thank everyone. I'm going to put my email in the chat. I will share the recording so that you have access to it. But if you have questions or follow-up, feel free to send them along, and then I can work with Mary Jane to help get, you know, them answered. And or Mary Jane, if you just want to go ahead and throw your contact information in the chat. But this was so beneficial on so many levels. So I'm just grateful for you being willing to present on this important topic, and for those that attended for being able to join us. And good luck on your as you prepare to graduate for those.
Yeah.
Thank you very much. This was very informative. I appreciate everything.
Yeah, it was really nice to meet you all. And thanks so much for having me, Michelle, Ashley, and Sophia. It's been a real pleasure.
Thank you.
Thank you.
Bye, everyone.
Bye, everyone.
Thank you.